Going to scan the room to make sure there's no notes around or cheat sheets. Let's get that set up for you guys. I checked the patient's chart for any doctor's orders. I washed my hands already. I provided privacy by closing the door. In some cases, it would be the curtain. I'm now going to ID the patient by two identifications. Can you tell me your name, please?
Jordan Michael Moore.
And your date of birth?
8/30/2000.
Okay, great. I'm Hannah. I'm going to be your student nurse today, and we're just going to be doing your chest to extremities assessment. What brings you in today?
Just a yearly checkup.
Okay. Are you in any pain as of right now?
No.
Okay, great. If you're feeling any pain at any time during this assessment, just please holler. I'm just going to ask you a few subjective questions before starting the assessment. Do you have any history of respiratory disease, surgeries, or trauma?
No.
Okay, great. Any history of smoking?
No.
Okay. Are you experiencing any shortness of breath?
No.
Any cough or chest pain occurring?
No.
Okay. Noticing any lesions or rashes?
Nope.
Are you taking any medication?
Nope.
Do you have any exposures to hazard, example, factory work or much?
No.
Okay. Do you attend the dermatologist regularly?
No.
Okay. I'm just going to inspect the skin. Feel the back of my hand. The skin color is appropriate for a necessity. Skin color is appropriate. The skin is warm and dry. The hair texture is normal. Patient is well groomed. The skin is dry. There's no tenderness noted. I'm now just going to check for your skin turgor. So the skin is retracting in appropriate time. The patient is well hydrated. I'm now just going to move down to your neck. And note that the neck is symmetrical and evenly distributed. I'm just going to have you go ahead and lay down for me, Jordan. I'm just checking for any jugular vein distension. I'm now just going to prop you up at a 45-degree angle real quick. And check the same. All right, no jugular vein distension. You can go ahead and sit up. No jugular vein distension noted. I'm just going to check the carotid arteries on each side. Okay, I'm going to do the other side now. Okay, great. Carotid arteries are equally bilateral at a +2. I would be using the bell, but I don't have one, so I'm just going to be holding it down a little bit differently. I'm just going to be listening to the 3 spots down the carotid, under the jaw, the midway, and under, for any brutes or verbal findings. Just going to go ahead and check that. Go ahead and do under the jaw, midway, and the base of the neck. And I'm just going to go ahead and do it to the other side. The jaw, midway, base of the neck. Okay, great. So there were no brutes noted. I'm just going to go ahead and move along to the arms while we're up here. Are you experiencing any weakness?
No.
Have you had any surgeries or trauma to the arms?
Nope.
Do you struggle moving them? Any change in range of motion?
Nope.
Okay, great. I'm just going to feel... And feel the skin temperature. The skin is warm, dry, there's no edema present at a +1. I'm now just going to have you squeeze my fingers for me, about as hard as you can. Just go ahead and pull towards you, still holding my fingers, and push back towards me. Okay, great. While doing those 3 things, I did not notice any weakness. They were equally bilateral. I'm now just going to feel your brachial pulse, so just go ahead and hold your arm out for me. Sometimes it's tricky, but yours is strong. Okay. Feel the other side. Okay, I'm just going to go down to the radial pulse down here. I'm going to do the other radial pulse. So both pulses at a +2, equally bilateral. I'm now just going to have you go ahead and lay down for me. I'm just going to inspect the legs. Are you experiencing any weakness in the legs? Any troubles walking?
No.
Okay. Do you experience any swollen feet?
No.
Okay. I'm now just going to feel down your legs. Just the back of my hand. There's no edema present. The skin is dry and warm. I'm not just going to have you pull your feet towards you. Okay. Then knee. Okay, great. That's just checking for the strength. I did not notice any weakness. Both are equally bilateral, pushing at the same force. Going to do it the same with the knees. Go ahead and push up. Sorry. Go ahead and push down. Okay, great. So same with the knees. I didn't notice any weakness or, and they're both equally bilateral. I'm now just going to have you close your eyes for me, and I'm going to do the sharp dull test on the bottom of your feet. Close your eyes and tell me where you feel it, sharp or dull, and what foot.
Dull. Left foot. Sharp. Left foot. Dull. Right foot. Sharp. Right foot.
I'm still going to do the capillary refill on both your feet. I'm going to do your fingers. So capillary refill, they all return within 3 seconds, which is a normal finding. Go ahead and I'm going to go and feel your popliteal pulse. It's sometimes hard to find, but I actually found it. It's equally bilateral at a +2. I'm going to do your posterior tibia. At a +1, equally bilateral. I'm going to do your dorsal pedis pulse as well. See if I can find it. Which is also at a +1 and equally bilateral. I would check the femoral pulse. I think I said that right. But for this video, I'm not going to be doing that. But it's good to know where it is, which is in the groin area. I'm going to go ahead and select. I'm going to be doing the anterior chest. Do you have any heart problems?
No.
Any recent cough you've been noticing?
Nope.
Any tightness occurring at all within the chest?
No.
Okay. Have you had any history of heart attacks?
Nope.
Okay. The patient is showing no signs of respiratory distress. Face is relaxed. No accessory muscles noted. I'm now just going to locate the PMI at the 5th intercostal midclavicular space. Observe for any heaves or lifts. Okay, no heaves or lifts noted. I'm now just going to inspect for skin color and condition by just feeling. Skin color and conditioner is appropriate regarding the anterior chest. It's warm, dry, no tenderness noted. I'm now just going to acetate the anterior chest wall over the entire lung field, which I'm just going to do a quick review of the landmarks. So the aortic is the right sternum border, second intercostal space. The pulmonic, which is the left sternum, second intercostal space. The Erb's point, which is the left sternum border, third intercostal space. The tricuspid, which is the left sternum border, fifth intercostal space, and then the mitral, which is the midclavicular line, fifth intercostal space. While I'm going to do this, I'm just going to have you breathe in and breathe out each time I move my stethoscope, each time I'm in these spots. So I'm just going to go ahead and start with the aortic. Start usually by finding. Go ahead and breathe in. third. You want to go to your fifth one. And now go to your last fifth intercostal space. Okay. So S1 and S2 noted. It's regular. No extra sounds. Murmurs noted. No wheezes, rhonchi, or crackles noted. I'm now just going to percuss the same area over the same entire lung field. Okay, great. Sounds are hollow. There's no abnormal findings while percussing. I'm now just going to go ahead and have you go ahead and turn around then. I'm going to use my hands to measure the AP diameter, just 1 to 2, which it is. So go ahead and do your chicken bone. Go. Okay, relax now. Go ahead and take a deep breath for me. Okay, great. It should be symmetrical, which is symmetrical. I measured the AP. I'm now going to do the tactile phonitis, and I'm going to just have you go ahead and say 99 each time I move my hand down. Just feeling the vibrations, which should diminish while you go down, so go ahead and start.
99, 99, 99, 99, 99.
Okay. No crepitus palpated. The vibrations did diminish while going down. I'm now going to percuss over the landmarks, starting from C10, under the scapula. Just go ahead and listen. Breathe in, breathe out. So lung sounds are clear. There's no wheezes, crackles noted. I'm just going to go ahead and percuss now in the same areas. All sounds are hollow, which is a normal finding. So, alright, so that finishes up our assessment. Did you have any further questions for me, Jordan?
Nope.
Alright, so your doctor should be in here just shortly. Thank you so much.
Thank you.